Hi, I'm Dr. Larry Wyatt. Welcome to Radiology Grand Rounds.
Hi everyone, it's Dr. Larry Wyatt with Radiology Grand Rounds. Our case this week is that of a relatively young male with bilateral hip pain and some stiffness. We're presented here with an AP view of the pelvis depicting from the inferior aspect of L4 through the mid portion of the pubic symphysis and out to both iliac wings. Film is well exposed and there are no technical problems that can be identified. Most striking radiographic finding in this case is the obvious mushrooming and flattening and incongruity of the femoral heads bilaterally. The flattening represents probably 50% of the height of what a normal femoral head should be in a patient of this age. In addition, there is also some sclerosis along the acetabular roofs bilaterally. The hip joint spaces are relatively well preserved and symmetrical, although there does appear to be a bit of widening bilaterally in the medial joint compartments themselves. I suspect this is secondary to the deformity in the femoral heads rather than any suggestion of any swelling within the joint. The fat pads surrounding the hip capsules are well visualized and don't seem to suggest any joint effusion. There may be a small bone island in the superior portion of the intertrochanteric region on the hip, approximately 2 centimeters medial to the greater trochanter, and another smaller one right in the middle of the femoral head on the right. No other evidence of any aggressive or destructive bone disease is identified. Sacrum appears normal. The asacroiliac joints also appear normal. There are a couple of congenital anomalies at the L5S1 level. The facets are asymmetrical, the right facet being more sagittal in orientation and the left facet being more coronal in orientation. In addition, there's an extra process coming off the inferior aspect of the right transverse process near the radiographic position of the pedicle. Soft tissues appear unremarkable. So the major radiographic findings we have in this case are the flattening and mushrooming and deformity of both femoral heads, along with some sclerosis of the joint margins and the acetabular roofs. These changes are consistent primarily with two conditions that occur during childhood, those being slipped femoral capital epiphysis, a Salter-Harris 1 fracture, and legg-calve-perthes disease or avascular necrosis of the femoral capital epiphyses. In this particular instance, the flattening of the femoral heads and splaying of the femoral heads is more suggestive of legg-calve-perthes disease. I would expect more of a medial slip of what were the femoral capital epiphyses from when this young man was a child, if I were to make that diagnosis. So I'm leaning more towards legg-calve-perthes disease in this case. The sclerosis of the acetabular roofs is consistent with early degenerative joint disease in this case, and the changes at L5S1 are congenital anomalies unlikely to be clinically significant, although there may be some biomechanical changes at that level. Legg-calve-perthes disease is a relatively common orthopedic condition seen in children, presenting most commonly with hip pain of insidious onset. It's more common in children, obviously, before the femoral capital epiphysis fuses to the rest of the proximal femur. It is bilateral in a more than usual or more than rare number of cases, and can be associated with other conditions like sickle cell anemia and other conditions of vasculopathy. In this particular case, the changes were from idiopathic bilateral legg-calve-perthes disease. The problem with this condition, if it's not found early and managed aggressively, is that you end up with the kind of changes that you see on this film. This young man is in for some precocious degenerative joint disease and likely will require hip replacement. Hope to see you again next time. We thank you for joining us on week 3 of Radiology Grand Rounds for this case of bilateral legg-calve-perthes disease. And